Good day, everyone. So to continue what I have discussed, for this discussion, I will be talking about some of the metabolic disorders in dairy cows. So, and then some of the management of lactating cows, the dairy farm biosecurity, and a typical know-how to diagnose a sick animal. So for here, the first metabolic disorder is the fatty liver syndrome. So usually this syndrome commonly occurs within a few days of calving in excessively fat cows. So prevalent ito sa mga cows that receive too much energy or not enough protein during their late lactation and during the dry period. So ang nangyayari na over-condition yung katawan ng mga cows. So yun yung tinatawag natin na over-conditioning. Although over-conditioning is not a metabolic disorder, pero it does predispose yung mga baka to an increased susceptibility to those disorders commonly occurring. That is why, just like from your swine production, you need to have a BCS or the body conditioning score for you to assess the body size of the animal or the body condition of the animal. Okay? So basically, ang nangyayari dito kasi sa fatty liver syndrome, yung mga overly conditioned na baka, they could accumulate excessive storage ng internal fat. And one target niya is yung liver. Kasi matatandaan ninyo sa digestive system nila noon that I have discussed, some of the nutrients will not go through to the body lahat. Yung iba mapupunta sa liver. And matatandaan ninyo that the liver oxidizes fats for energy. Nakakailanganin ng katawan ng mga animal. So kung ganito yung situation na overly conditioned yung baka, the cow mobilizes more and more body fat as the liver becomes increasingly filled with lipids or fats and increasingly impaired its ability to utilize these fats. So etong cycle na to could really affect or could really result to severe cases. And isa dyan is yung pagkakaroon ng ketone bodies. So ano tong ketone bodies? Ito yung mga partially oxidized na fats. So naproproduce sila from the incomplete na oxidation ng mobilized fats. So sa situation ng mga animals na merong ganito, the liver cannot metabolize the high levels of fatty acids quickly enough, kaya nagkakaroon ng ketone bodies. So once na na-release ang mga ketone bodies, these particles will usually affect now the appetite of the animals. So as a result, it would decrease their feed intake and eventually could drop down the production kasi of course magkakaroon ng decline din sa body conditioning score nila, and usually etong syndrome na to ay correlated sa ketosis na sakit din ng dairy animals. Pero hindi lang dyan, pwede ding makorelate itong sakit na to in other disorders, just like for example sa milk fever, sa metritis, and then even with other edema. Okay. And lastly, it says here that cows that can acquire fatty liver are those that are losing weight most rapidly. Okay? So ibig sabihin, it is important to remember na ang nagkakaroon nito ay yung mga animals na mabilis mag-lose ng weight, na parang hindi na yun normal yung lose weight na yon. Okay? So just for example, kumbaga over-conditioned yung baka, medyo mataba siya, tapos biglang pumayat ka agad. So that is a good indicator as one causes na pwedeng magkaroon siya ng fatty liver or meron siyang fatty liver syndrome. Okay? So papaano to ma-prevent? Papaano natin ma-prevent itong metabolic disorder na to? Una, of course, as what I have said, na dito sa fatty liver syndrome ay mainly caused by overly or mainly attacked by overly conditioned ng mga baka or ng mga dairy animals natin. So ang pinaka-main na target mo dapat or pinaka-main na focus mo as dairy producer, of course, is do not overfeed. Okay? Do not overfeed. Kailangan balance ang ibibigay mo na pagkain in terms of protein and sa energy. Okay, yung energy source which is sa carbohydrate, as what I have discussed noon sa mga basic classes of nutrients. that the carbohydrates is the most or the majority of the ration or the majority of the energy source ng mga livestock animals natin ay from carbohydrates. So kailangan balance si protein tsaka carbohydrates. Do not overfeed carbohydrates doon sa mga baka natin kasi this is one reason also kung bakit nagkakaroon ng fatty liver syndrome yung mga ibang animals natin. Okay? And then next one, yung sinasabi ko kanina is the ketosis, which usually affects high-producing cows 10 days to 6 weeks following parturition. So yung incidence nito could really increase as the cow approaches peak lactation. Okay, so this disorder is considered as one of the most common na metabolic disorders sa mga dairy animals natin. So ano ang nangyayari dito? So this metabolic disorder is characterized mainly by an increased concentration ng mga free fatty acids and of course ketone bodies sa blood and urine ng mga dairy animals natin, and eventually a decrease in glucose concentration. So as what I have said kanina, the ketone bodies here are formed from the incomplete oxidation ng mobilized fat. And usually pag ganito na yung na-produce, etong mga ketone bodies, they usually build up now sa dugo or sa blood ng mga animals natin and even sa milk and sa urine nila. Kaya kapag mataas ang concentrations ng ketones sa dugo, doon nagsisimulang mag-cause ng detrimental effect sa appetite nila. Okay? Now for ketosis, meron tayong dalawang uri, yung primary and secondary ketosis. So kapag primary ketosis, ito yung sinabi ko kanina or diniscuss ko kanina sa fatty liver syndrome. Ito yung na-observe natin sa mga dairy animals natin na overly conditioned at calving. And di ba, as what I have said, as they start lactating, dito nagkakaroon ng lower feed intake and impaired na liver. Yung secondary ketosis naman, ito is being caused sa low energy ration na pinapakain natin sa kanila or from decreased intake ng normal rations. Okay? Now to add up yung mga nasabi ko or na-discuss ko, aside from what I have said, the usual symptoms ng ketosis is an abrupt drop in milk production, depressed appetite, dry feces, and constipation, and even drowsiness. Pero not all of them kasi yung ibang baka and yung ibang mga animals natin, they still appear to be more excitable. Okay? Hindi lahat sila ay nagkakaroon ng drowsiness. Now, as what I have said kanina, etong ketosis is being caused by a decreased concentration ng glucose. So the treatments for ketosis are usually designed to increase yung blood glucose ng mga animals natin. But take note that feeding glucose is ineffective. Okay, ineffective yung pagpapakain natin ng glucose kasi yung rumen microbes can convert that glucose to VFAs or the volatile fatty acids. Kaya it is advisable that oral glucose precursor is often provided as a preventive measure and as a treatment for affected cows. Now, last metabolic disorder that is being common to these animals is the milk fever. Okay, so from the word itself, milk fever, so this is usually being caused by a rapid drain ng calcium from the blood to the milk that will be produced. So yung blood changes that are associated sa milk fever could cause a depressed blood calcium level. So there is a decline of blood calcium level. Okay, also with hypermagnesemia and hyperglycemia. Now for the milk fever, this is usually being associated with parturition and the initiation of lactation, and it mostly affects high producing cows during the first 24 hours following its parturition. Okay, although pwede pa ding mag-occur at any time in lactation period and even prior to calving. Pero since as the statement says here, most often. Okay? And then although this is a problem sa lahat ng breeding or sa mga breeds ng dairy cows, sa kanilang lahat, yung jerseys yung talagang pinaka-susceptible sa sakit na to. Okay? Now, most of the symptoms of milk fever could be correlated, as what I've said kanina, sa lack of blood calcium. And we all know that calcium is essential for muscle function, and the loss of this function is the most apparent symptom in these animals. Kaya ang usual na treatment nito is by infusion of calcium intravenously. So those are some of the metabolic disorders that I have provided it to you. Now, for the managing of lactating cows, there are some issues that we need to take for consideration after calving. And we need to take note of it that in order for us to maximize our profit sa mga dairy animals natin, we need to be focused also in optimizing milk production. And for us to attain this one, we need to exert some special efforts and after calving. Okay, the cow should be closely monitored for health problems, and one way to do this one is a regular monitoring through rectal temperature and urinary ketone levels. This is aside from the monitoring doon sa feed intake and milk production nila kasi that is also given as one management practice also. Okay. Now, aside from these factors that I have said, another area to be monitored is yung postpartum period. Okay, yung postpartum period nila wherein kailangan is we need to observe yung resumption ng normal reproductive function nila. Wherein within 3 to 4 weeks, the resumption of the ovarian cycle should be noted already. Next one, for this, there are actually some strategies that can be used to improve the lactational persistence ng mga dairy animals, which include the milking frequency, the long daylighting or the photoperiod effects, and then the use of bovine somatotropin. Okay. Now take note that although I have provided these strategies, their responses to these are additive. Okay? Pag sinabi kong additive, meaning to say that the use of one strategy does not really impair the response to the introduction of a second strategy. Okay? Now for the milking frequency, kapag tinaasan daw yung pag-milk sa mga dairy animals, especially sa mga dairy cows natin, from 2 times to 3 times daily, this could really increase also their milk production for about 6 to 8 pounds per day, regardless ng level ng milk production or parity. Okay? And also, ano pa yung pwedeng maibigay na benefit ng milking frequency sa mga dairy animals natin? Okay? It is also being noted din na removing the milk, okay, or by extracting the milk from the gland more frequently could also remove the pathogens that are present in the milk before they will have their opportunity to multiply to concentrations higher than the immune system can control. And also, pag frequent yung milking, it also reduces yung incidence ng mastitis, which of course we can minimize the damage to these secretory cells caused by this disease. Okay, kasi that is one of the most common diseases ng dairy animals natin, yung mastitis. And then, so yun yung sa frequency or milking frequency. Now, what about for photoperiod effects? Pag sinabi natin na photoperiod effects, although lighting is often neglected as a parang crucial component ng cow management, and although improper lighting does not result to any disease or does not really result to diseases or injuries, pero nakaka-apekto ito sa production and lactational performance. Okay? But this is only applicable sa mga totally confined na dairy animals. Pero since yun naman talaga ang pinaka-common sa mga dairy animals natin, they are really set into a confined feeding system. So definitely they should be given lighting also within their housing facilities. Okay? And based from studies, those animals, especially the cows, which are exposed to long daylighting, which is 16 hours light and 8 hours dark, could produce about 5 pounds more milk per day when we compare it to those which are exposed to naturally varying day lengths ng mga animals. Okay? Pero if you want to combine the long day lighting with milking 3 times daily, it is important to be reminded na kailangan na the lighting in the housing facility should not be continuous. Okay? Although this could be a challenge also since yung light is kailangan din ng mga farm workers to be able to move the cows safely. Yung dark period is as important as the light period also for the lactation response. Okay? Now for the bovine somatotropin, this is also being used as a management tool na available to dairy producers for the improvement or for improving persistency of lactating cows, and through injections of BST could act to supplement naturally released somatotropin in the circulation of the cow. Now we move to another topic, which is the dairy farm biosecurity, which really becomes a high-profile issue now among the dairy producers in the past years and in the past decades. So ito na yung isang high-profile issue, and even hindi lang naman sa dairy farm, this is applicable to all of the farms na intended for production. Kahit anong farm animal pa yan, it is a really a high-profile issue sa lahat natin. Okay? And take note na kapag sinabi natin na biosecurity, this is not just only about reducing the risk of introducing new pathogens sa dairy herd natin, but it also includes yung management practices that reduce the spread of pathogens within the herd. Okay, that is for the people within the herd. Now, what about for the people who are considered to be visitors sa farm mo? So just like what other farms are doing, kailangan yung mga papasok sa farm should wear boots. That is recommended. Yung mga papasok sa farm mo should wear boots, and dapat din palitan nila yung damit nila pag papasok sa farm. And dapat maliligo din sila. That is yung recommended na form of strict biosecurity. Okay? Kasi pwede mo namang sabihin na biosecurity, but then if you want to really be strict sa biosecurity measures mo to avoid the occurrence of any diseases into your animals, then you should implement very strict biosecurity measures. Okay? So once na pumasok, just for example, once na pumasok yung bisita mo, dapat before napapasok siya sa mismong farm, meron ka dapat isang facility na kung saan didiretso yung tao, then magpapalit ng damit, maliligo, and dapat palitan din niya yung slippers or any footwears. Okay? So after that, kailangan mag-provide ka as personnel or as animal producer ng gagamitin niyang damit as well as boots to prevent any pathogenic exposure sa mga animals natin. Okay, that is considered to be a strict biosecurity standard na implementation. Now, what about for the animals, or what about for the new animals? So kailangan, as what I have discussed na noon, you need to set a quarantine period sa mga animals, since these are the most common sources also of exposure to new pathogens. Kasi hindi mo alam na yung pala is carrier ng any pathogen coming from that specific location, tapos i-expose mo kaagad sa mga animals mo. That is a big no as animal raiser. Okay? Now, before anything else, and before you achieve a successful operation, the producers must address, or as animal producer, you must address 4 primary goals in any biosecurity programs. I have made it in a general way so that it is being applicable not only for the dairy production but then also with other animal production. Okay? So una, minimize the use of treatments, especially the antibiotics. It is important for this one that producers must use antibiotics judiciously. Okay? So kailangan as a raiser, the appropriate use of antibiotics should be followed. And kapag inappropriate ito, pag inappropriate ito lang and you just want to administer it to them even if they are not really sick, then the inappropriate actions for antibiotic supplementation could have a direct implication on the development of antibiotic resistant strains of bacteria within the animals. Okay, so you need to minimize the use of treatments. You should be implementing it only, you should be administering it only if kailangan talaga. Okay, then second one is to minimize pathogen load to the animal. So before you achieve this one, sanitation could be considered as the most important aspect of maintaining animal health. Okay? So kailangan to break or to stop the life cycle of many pathogens. Cleaning and disinfection are really critical important aspects dito. Okay? Para ma-minimize mo yung pathogen load to the animals natin. Then third one is to maximize the immune function of the animal. So papaano to mai-improve? So kailangan as an animal raiser or dairy producer, I should say, dapat magtulungan si veterinarian and ikaw na producer in formulation for a vaccination program that is really specific for the management skills and pathogens. So kailangan yung i-formulate mo na vaccination program should really focus, as what I have discussed noon, sa risk ng disease, sa yung cause associated with a disease outbreak, yung cause ng vaccine, and eventually the efficacy of the vaccine. Okay? Then lastly, as a dairy producer, you should minimize also the potential for disease transmission. So you need to monitor yung people and cow flow patterns. Yung sinabi ko kanina na kapag may bumisita na or may pumasok na bisita, yun yun. Okay? Yun yung tinatawag natin na people and cow flow patterns. Then also dapat walang mga pets and pests doon sa farms kasi they are one of the most common sources din ng pathogens. Kasi syempre di mo alam kung saan sila nagpupunta before napapasok sila sa farm mo. Okay, so that is a simple background on a dairy farm biosecurity measures or biosecurity standards na kailangan mong i-achieve before you will have a successful production in terms of dairy. Now moving on to the last topic, which is on the diagnosis of a sick animal. Okay, always remember that the key to a successful treatment is early diagnosis. Okay, so kailangan you need to have an early diagnosis. Dapat maaga pa lang alam mo na yung possible na mangyayari. So you need to recognize the signs of a specific disease to, of course, to initiate an appropriate treatment and to ensure a speedy recovery and of course to avoid losses. And since we are into dairy production, yung mismong milk production ng dairy animal is also a good barometer of the health of the animals. Okay? But for other signs nito, pwede nating i-observe if di na sila kumakain ng maayos, then may problem na. Or yun yung tinatawag natin na depressed appetite or the decline of the appetite ng mga animals natin. Ano pa ba? Yung lack of rumination. Yung kapag resting period na yung mga animals natin, yung nagpapahinga na sila, hindi naman na sila kumakain, and di mo sila nakikita na ngumunguya, then may problem na yon, panigurado, and even lameness or fever. So kailangan as a producer or an owner of a certain dairy farm, kailangan meron kang rectal thermometer and stethoscope. Okay? Etong dalawang to, thermometer and stethoscope, should be available at all times to detect abnormalities and other illnesses that can occur. Okay? So of course, by using a stethoscope, then you could also obtain the pulse rate and breathing rate ng animals natin. Okay, so this is now the end of my recorded discussion. I do hope that you have learned something from this discussion. Thank you very much for listening.